When you talk about KEPI and baby friendly just means that the side effects are less for your baby. And what are these common side effects you're expecting? It could be fever, could be the fussiness or irritability, a bit of poor feeding. You may have pain at the site of the injection when you go home, some reddening or some swelling on that site as well. These things are still temporary, they're short-lived. Within 24 hours they resolve, but they can be quite distressing to the parents. So the baby-friendly reduces the side effects. I'm not saying your baby will not have a fever or a baby a bit fussy even with baby-friendly. It could happen, but the chances are remarkably less, significantly less with baby-friendly as compared to KEPI, although your baby still gets fully vaccinated. Of course, now on top of that is the cost implications. KEPI is usually more affordable compared to the baby-friendly vaccine. So that's something that a parent needs to be aware of as they choose which vaccine to get.
And also some parents will say that I gave my baby KEPI and they never experienced any side effects, so no need of giving baby friendly.
Exactly, that can happen, and you'll only know once you get the vaccine. So some patients may have a terrible experience with every vaccine schedule they get, and others may have a low-grade fever that goes on its own, not even giving any paracetamol. So it's an individualized experience, and we take it as patient-by-patient basis, but still encourage patients to get their vaccines, whether it's KEPI, whether it's baby-friendly, to ensure your baby is fully immunized and at the appropriate ages. As I said, it's 6, 10, and 14 for that batch of vaccines.
Now, confused by your baby's vaccine schedule, Dr. 𝗪𝗰𝗰𝗶𝗀, a very kind pediatrician, is here with us to guide you on which vaccines to give your baby. There are so many myths and misconceptions, especially here in Kenya, everywhere, about baby-friendly or the KEPI, which is the government vaccines. Which ones are the best? There are those misconceptions. When you give this happens. Do we even have the best or not? We'll find out from Dr. 𝗪𝗰𝗰𝗶𝗀. So stick here, like, share, subscribe, because we have so much insightful content for you. Without so much further ado, let's get straight into our discussion. Once the baby is born, as a new mom, I didn't know that they're supposed to be injected. Is it the same day or the following day? As in, especially like the baby is so tiny and they're being injected.
Yes.
It's so easy for a mom to say, you know what, I don't think you should do this. So let's talk about once the baby is born, why it's important to have those first vaccines, because some moms might have reservations, especially if your baby was born either before time or even somehow almost close to underweight. Yes.
Okay, so vaccines are aimed to prevent illnesses, and there are various preventable infections that come with the vaccines. So vaccination at the newborn period, we are trying to prevent illnesses that baby can acquire from mom. And they can actually acquire due to the low immunity at that early period. The first that we give is the hepatitis B vaccine. That's usually given within 24 hours of delivery. It's an infection that affects the liver and can be transmitted from mom to baby.
Through breastfeeding.
Through delivery. Yes.
Okay.
So sometimes you have a mother who's infected, either was not screened during the antenatal visit. Remember, we screen for hepatitis B. Others, it's too early of the infection and you're not able to detect it. So it may be a false negative, and the mother actually has it. And the effects to the baby can be quite detrimental. So that's why it's very important to vaccinate all babies against hepatitis B. Another injection they get is vitamin K. And the other vaccines are now the oral polio and the BCG that we give shortly after birth, or at least within the first 2 weeks. So those are the first vaccines we give soon after the baby is born.
The vitamin K you said,
Yes.
and the BCG, why are they necessary to give within 2 weeks?
So vitamin K is very important to prevent any bleeding that may occur shortly after birth. So that one we give still together with the hepatitis B as the baby is born. And then your BCG and oral polio, that is the first vaccination schedule that we actually give, the one that causes for you the BCG scar, right? In our setup in Kenya, it's actually one of the requirements of our vaccine schedule. Yes.
All right, so let's talk about now you've gone home So the schedule, when you're supposed to come back for those injections, why are they important? We've also seen we have government, we call them KEPI here in Kenya, and the baby friendly. And you realize that especially in Kenya, if you're taking baby friendly, there are more vaccines. If you're taking KEPI, there are few. As in, just like clear the air on all this confusion. Yeah.
So we start the vaccines at birth, and the next visit that you come that we give vaccination is at 6 weeks. At 2 weeks, remember, it's just a routine checkup on baby and weight gain. At 6 weeks, 10 and 14 is when now we give the vaccines that now we refer to the KEPI and the baby friendly. That's the one that's limited to those two options. And the vaccines, or rather the diseases you're trying to prevent, there's one vaccine that has a 5-in-1 or a 6-in-1. And this prevents against diphtheria, pertussis, tetanus, hepatitis B, polio, and Haemophilus influenza as well. You have the rotavirus vaccine also given. So there are different formulations. As I said, it can either be a 5-in-1 or a 6-in-1. You also have the pneumonia vaccine given as a separate jab. You'll see your baby usually gets 2 injections and 2 oral ones. The oral are your oral polio and your rotavirus. So these vaccines are given at 6, 10, and 14 weeks. And this is when we talk about baby friendly and KEPI. So KEPI vaccines is a 5-in-1. That's 1 injection with diphtheria, tetanus, pertussis, hepatitis B, H influenza type B as 1 injection. The next injection is the pneumonia vaccine. Orally, we give the oral polio that protects against 2 strains of the oral of the
That's
polio.
at 6 weeks.
Yes, at 6, 10, and 14. Oral, given as the strains for the 1 and 2 oral virus, oral polio vaccine, and then the rotavirus is also oral. When you get the baby friendly, the polio is in the 6-in-1. It's given as an injectable. So it's given at 6, 10, and 14. Because we don't give the inactivated polio vaccine for the KEPI babies, they get it as an injection at 14 weeks. So if you're following the KEPI schedule, your baby will get 3 injections at 14 weeks to provide full immunity against the polio virus. As I said, the oral only protects against 2 strains. So the government tries to provide comprehensive coverage by giving this vaccine at 14 weeks. When you talk about KEPI and baby friendly just means that the side effects are less for your baby. And what are these common side effects you're expecting? It could be fever, it could be the fussiness or irritability, a bit of poor feeding. You may have pain at the site of the injection when you go home, some reddening or some swelling on that site as well. These things are still temporary, they're short-lived. Within 24 hours they resolve, but they can be quite distressing to the parents. So the baby-friendly reduces the side effects. I'm not saying your baby will not have a fever or a bit fussy even with baby-friendly. It could happen, but the chances are remarkably less, significantly less with baby-friendly as compared to KEPI, although your baby still gets fully vaccinated. Of course, now on top of that is the cost implications. KEPI is usually more affordable compared to the baby-friendly vaccine. So that's something that a parent needs to be aware of as they choose which vaccine to get.
And also some parents will say that I gave my baby KEPI and they never experienced any side effects, so no need of giving baby friendly.
Exactly, that can happen, and you'll only know once you get the vaccine. So some patients may have a terrible experience with every vaccine schedule they get, and others may have a low-grade fever that goes on its own, not even giving any paracetamol. So it's an individualized experience, and we take it as patient-by-patient basis, but still encourage patients to get their vaccines, whether it's KEPI, whether it's baby-friendly, to ensure your baby is fully immunized and at the appropriate ages. As I said, it's 6, 10, and 14 for that batch of vaccines.
And for how long should the baby be getting these vaccines? Because I've seen some vaccines going up to, is it 12 years, is it 14 years?
Yes.
So maybe at this point you can take us through, maybe even without saying much on what they're, but at least at so that moms can know that if I'm at 6 weeks, I need this. If I'm at 14 weeks, I need this, up to, is it 14 years? Yeah,
Yes.
if you can take us through that. But just before that, Doc, maybe you can mention why baby-friendly vaccines are more than the KEPI vaccine, because there are moms that are giving KEPI and others baby friendly, and then when you're just having conversation, you hear mom saying, I went for this jab, and then because the other one is on the other program, they're like, but I can't see it in my book. Yes.
Okay.
Yeah.
So the booklets may be different based on if you're getting your vaccines from a government facility or a private facility. It's a misconception to say certain vaccines are private or they are baby friendly, because they are all necessary. They are not optional vaccines, as people tend to say. In the government schedule, yes, they are at 6, 10, 14 weeks, at 9 months, and at 18 months. That you will see on your government schedule, because that is what the government has provided at a subsidized cost. But all the vaccines are important. So when you go to a private facility, beyond the 14-week mark, you'll have a vaccine at 6 months, which is your flu vaccine together with your vitamin A. At 7 months, they get their second flu shot. At 9 months, they'll get the measles, mumps, rubella. At 10 months, they'll get meningitis, which is a very important, illness. And then at 12 months, they'll get the cholera, the chickenpox, hepatitis A. And after that, at 15 months, they get some of the boosters for hepatitis A, for the chickenpox as well, the meningitis, all through, and up to even 9 years, right? 9 years, we have the HPV vaccine, which is very important.
So after 15 months, the next is one.
We have 18 months, we have 1 year and 2 years as well. Okay.
So it's 18 months, 2 years,
2 years, yes,
and
then 3 years.
And 3 years. So
yes.
what do we give at 18 months, 2 years, and 3 years?
So most of them are boosters.
Okay.
So you have immunity when you get these vaccines initially at the 6, 10, and 14. For example, the DTP. But you need boosters to continue and at least increase the immunity, because immunity can wane off with time with some of these vaccines. So boosters are actually important at the 2-3 year mark, as well as even for adolescents as well, or children who are at high risk, children who are immunocompromised, on steroids because of cancer, sickle cell illnesses. They're really predisposed to things like pneumonia. One thing to mention is malaria vaccine. Malaria vaccine was rolled out in counties in Nyanza and Western. These are the malaria endemic zones. So we actually have vaccines preventing against malaria as well now, that are in the schedule, but are assigned to children born in those areas.
So after 3 years as a mom, I'll now relax from this schedule and maybe wait up to adolescent for the HPV for a girl.
And boys as well. Okay. Boys also contract the HPV virus. We usually forget the boys, but girls and boys should be vaccinated from about 9 years. From 3 years onwards, and even for adults, an annual flu shot is actually recommended to reduce the incidences of you getting the flu. And every year it's formulated based on what flu is actually circulating in the environment, and that's why it's important to get it every year. And then at 9 years, we give the HPV vaccine to both girls and boys.
Yeah. And the first weeks of giving vaccine, that's when we see a lot of fever with the babies. Most doctors will say, no, don't give any medication, just let it go on its own. Others will say, no, just give some Panadol. So what would you advise as an expert? And again, are there home remedies that moms can do? Because it's sad seeing your baby in pain. I mean, you know what I mean.
Yes.
Yeah.
So the thinking about not giving paracetamol is that you actually want to let the body mount that immune response with a vaccine, and you don't want to kind of diminish it by giving paracetamol. But if you really do need to give the paracetamol, you can give. Usually, if you find your baby has a fever, that even with removing and just leaving them in a diaper and a vest is not going down, then you can give some paracetamol as recommended by your healthcare worker. And then encourage breastfeeding as well, frequent, because sometimes they tend to feed poorly during that period in time. Remember, this is just short-lived, so within 24 hours, your baby should be fine. But I always advise just have some paracetamol in case your baby's in a lot of distress. You can give.
When should I call a doctor? Because sometimes a baby is having fever, and instead of Panadol, you're like, no, we need to go to the hospital. Should you take your baby to the hospital because of this side? Like, can it get extreme that, what? Yes, it's a vaccine, but you need to take her to the hospital. Yeah.
If you have a baby who's having a fever above 40, that's unrelenting, please do bring the baby to the health facility. A baby who's been crying continuously for 3 to 4 hours, a very irritable baby, I'd advise them to come in for a check. Sometimes there are babies who may, very rarely though, may have a reaction to the vaccine. Maybe develop some hives, itching, rash, and reddening. I'd advise them to come in.
And why are they spaced out in the first place? These vaccines.
Yes, so they're spaced out usually around a month period. Every 4 weeks is when you get the vaccine, to give your body time to actually mount this immune response and provide an adequate immune response to the vaccine. So you don't want to keep them too close together. You want to give the body time, and that is what studies have shown, that within that 1 month, or some of them even require 3 months to be able to mount that immune response before you overwhelm the body with another dose of the vaccine.
Lastly, Doc, now, so many misconceptions surrounding vaccinations. This, you'll hear from someone who is very senior, or someone you respect, that these vaccines cause cancer, they will cause long-term complications, they'll cause infertility on children. Is it true?
So there are a lot of misconceptions out there about vaccines. There's a lot of misinformation and over-information as well in different forums, and advise patients to come and talk to a healthcare professional. If you find there are people who are being biased, please also go up and read. And don't read one article, read a couple of articles and come and discuss with us. We're very open to having a discussion to see what exactly are your reservations, what are you scared of, is it the side effects that people have talked about, because there's some misinformation that we actually need to debunk as well when we meet. So that we're able to see, this was one article that was actually giving false information. Don't take everything that's out there as truth. Sit with a healthcare provider, and we will not push the vaccine on you, but give you an informed information so that you can make an informed decision.
And for those parents who are yet to give their babies vaccines, they have skipped and they're watching this and they're like, okay, I think my baby needs vaccines. Is it too late?
It's never too late. It's never too late. Please visit your healthcare provider, come with your vaccine booklet, and we have a look at where we can actually catch up. We call it a catch-up schedule. This happened a lot around COVID a lot. We had patients who missed vaccines because of that, or sometimes you have traveled or relocated. Come in and we have a look at where we can actually catch up your baby on vaccines so they're fully immunized and fully protected against all these illnesses.
All right, Doc, thank you so much. Thank you so much for your time. Thank you so much for having us. I know this series we have done is really helping a lot of women, and they will we will share your details. Maybe you can even tell them where to contact you or where to reach out to you, so that, yes, when I reach out here, I know it's Dr. Onyoike who is going to directly respond to me.
Okay.
Yes.
So you can find me on Instagram, pediatric mom, pediatric_mom, all in small letters. You can send in your questions, and I'll also give you something that they can actually just open up the link and ask their questions, find some useful information. I actually have some things up on vaccination, nutrition, childhood development issues such as autism on the page that you can have a look at for reference. Today, as we said, we're here at 𝗓𝗓𝐻𝐿 Medical Center, 4th floor, where they have pediatricians and obstetricians who are also open to answering your questions.
Thank you so much. And so share this with the mom so that they do not miss out on some of these vaccinations, because on this episode, we have really highlighted the schedule for vaccines for babies. So make sure you share with the mom, and let's keep empowering one another. My name is Purity Afya Show. It's been a pleasure having you. Let's see each other on the next one.